Fox News alert as 4 more boys are now freed from the flooded cave in Thailand. What an unbelievable story this has been. 8 boys are now safe and sound. They're being observed at a hospital, but the rescue operation is ongoing for the 4 remaining boys and their coach. They have to take a pause in the process. Officials say that oxygen tanks have to be replenished, and they suggest that others could be brought out in the early hours of tomorrow morning. Doctors say so far the health of those inside is still good. Joining me now, Marc Siegel, doctor and professor of medicine at NYU Langone Medical Center and Fox News medical correspondent, who we all know very well. Doctor, great to see you.
Martha, great to see you.
As always. So, how much does it help these children that they are children going through this? Isn't it an advantage for them at all that they're resilient and young?
That is an advantage, and that will help them. But I want people out there to know that children suffer from post-traumatic stress disorder, just like adults do. And with children, you got to get them early. Studies show you got to get them quickly. So when you're in a dark cave for 15 days and your circadian rhythms are off and you're not sure where you are or even when you're going to get out or if you're going to get out, cohesiveness helps. Courage was obviously there. They had a team approach. All this will help prognostically going forward. But they're going to need treatment. They're going to have flashbacks, my opinion. They're going to have derealization, periods of disorientation. All that can be treated with cognitive behavioral therapy and possibly medication, but therapy is key here, and the earlier the better.
How long do you think it will take to get them home? Because that, I would think, would be, once they're ascertained to be healthy, the next most important step in their recovery. Huge,
because they haven't seen their parents. But I would say, medically, look, we see them smiling, we see them saying they're okay, but they were in caves drinking off of stalactites, so they're malnourished.
For over 2 weeks.
Right. They've got to get nutrition. They're going to get intravenous fluids. They're going to get slowly replenished. You can't just bomb the GI tract with regular food right away. So they're going to get brought back. They're going to check electrolytes, liver, kidney, oxygen. They had oxygen deprivation. They probably had too much carbon dioxide. They're going to give them oxygen. They're going to watch their lungs very carefully. But the fact that they were able to swim out like this shows that they probably didn't have severe oxygen
We were
effects.
talking about how they brought the strongest out first and one who was not doing well. So the youngest, maybe smallest, the ones who don't know how to swim are the ones who are still in there. That's going to be very frightening and very scary for them, no doubt, getting them out.
And the key there is going to be the guides. I call them fear guides, people that are going to help them. That line where they're brought out by that line they can hold on to. Yes. But while they're in the cave, there's the risk of infections. There's the risk of bats, birds, bacteria. All of these things they're going to look very carefully at the hospital. I think they're going to be fine. I think they're going to get all 12 out and the coach.
I hope so.
I hope and pray I think they're going to be okay.
Dr. Marc Siegel, good to see you.
Great to see you.
Nice to see you.